need laundry. All emergency.
So Elsa, what's with the whole get-up here?
Well, on the ship, when one person gets sick, everybody gets sick, especially in the academy. And so this is my not sickinator. I have a stuffed up nose. Blow my nose. I can throw it away. Boom. And then I can wash my hands, because washing your hands is amazing.
I would like to order one of these as soon as possible. So something I've been really excited to do through these vlogs is introduce you guys to a variety of different crew members who live and work in different roles here on the ship. And so a few weeks ago, I introduced you guys to Dr. Kylie Wood, which was awesome. And this week, I want to introduce you to Dr. Michelle White. Also, sorry for the noise. The lifeboat is coming up as I speak right now. Oh, it's Emerson. Okay. Anyways, ship life.
So I'm a British anaesthesiologist, or as we say in England, I'm a consultant anaesthetist. And I first heard about Mercy ships when I was a medical student, and I can really remember seeing the old ship and having a look in their operating room, and I thought, wow, that is amazing. Like, that is so cool. I would love to be a part of it. And so for many years, about 10 years or more, I prayed for the ship, and I would support the ship as someone that would do fundraising and that type of thing. And then the first time I actually got to visit the ship and see it in real life was in 2005, and I came to work on the ship as an anaesthetist, and it was just an amazing experience. It was everything that I hoped it would be and more. I was absolutely blown away by the quality of the surgery that Mercy ships did in such extreme conditions, and from then on I thought I want to be a part of this.
Could you talk a little bit about what Mercy Ships is? So what do we do as an organization?
I think what Mercy Ships does is we aim to provide surgical services, we aim to provide training, and then we aim to come alongside governments and people in the country to advocate to make surgery safer, because about 2/3 of the world's population don't have access to safe surgery. So we come alongside and try and fill just a tiny bit of that niche in the countries where we serve, and we try and base everything that we do on research, or to put it another way, just good medical practice that's known to be good and proven to be good. So we do a variety of surgeries. A lot of surgeries are things that people can't get in the countries where they are. They don't have specialists in plastic surgery to repair children after they've suffered burns. They don't have people who can fix facial tumours, or even children with a cleft palate. Very things that would be simple in the countries where I come from, they're just not simple here. So we can provide those services, and then try and, with training, just strengthen the surgical system so that people in the countries where we are can make more of the resources that they've got and build their capacity to serve their own people.
If you could dream big with Mercy Ships, where do you see us going?
So I think as Mercy Ships goes forward, it's really a question of every country you visit working with the government to say, you know, what do you need? These are some of the things that we might be able to come alongside you and help you with. Where can we collaborate together? And what are other organisations like Mercy Ships doing so that we can, you know, all work together? Because, you know, partnership and relationship really is the way forward. It's too big a problem to sort out as one individual. And surgery is very, very complex.
Yes.
It requires roads, it requires water, it requires electricity, it requires people training, a supply chain. It requires you to do research. What works best in England or America might not be the same thing that works best in Africa, because of different disease conditions and different types of things that you come across. So we need to make everything that we do very, very relevant. So I'd like to see, you know, Mercy Ships grow in our surgical program so that we can craft those to meet the needs that we see and train people in those things.
So I just got back from the OR where I was interviewing the next person I want to introduce you to, which is Dr. Mark Shrek.
My name is Mark Shrek. I am one of the ENT head and neck surgeons here on the ship. Back home, I work as an ENT 1 day a week, and I spend the other 6 days a week as the research director for Harvard's program in global surgery. I've been coming to the ship since January of 2008, so it'll be 10 years and a couple months. So my research focuses almost exclusively on the problem of surgery in low-income countries. We found through the Lancet Commission on Global Surgery, through the research we did for that, we found that 70% of the world's population, 5 billion people, can't actually get safe, affordable, and timely surgery. And there's a whole bunch of barriers that cause that. Half of the world's population, if they tried to get surgery today, would impoverish themselves to get it. Much of the world's population doesn't live close enough to a hospital that actually can provide surgery, and the hospitals that are providing surgery aren't providing enough surgery in low and middle income countries. So that was the research that we've done. My current research focuses on ways that we can start to overcome some of these barriers, and my particular focus is on that financial barrier. I'm very interested in the intersection between poverty and surgery, which is an intersection that goes, there's sort of an easy intersection, which is that if you're poor, you can't get surgery. But the more interesting intersection for me is that because of the costs of surgery, surgery itself can drive people into poverty. And that's where I'm focusing my research.
So there's a story I love, which you've probably heard, but I'm going to tell it anyways. And it's called the Starfish Story. And basically in the story, there's this beach full of hundreds and hundreds of washed up starfish that are drying out on the sand and dying. And then in the story, there's this little boy who goes along picking the starfish up one by one and flinging them back into the water to save them. And then this crusty old man comes up to him and says, "Little boy, what are you doing? Don't you see how many starfish there are? Why would you even think that you could begin to make a difference just throwing them in one after one after one?" And the little boy didn't say anything, but he picked up one of the starfish and threw it into the water and then said to the man, "Well, it makes a difference to that one." And then he picked up another one, and that one, and that one, and that one. And we tell this story a lot here because it can feel very overwhelming and hopeless at times to see how much need there is and wonder how we can even begin to make a dent in it. But what that story tells us is that you may not be able to change the whole world, but you can change it for one person at a time. Mercy Ships now is moving in a direction with their medical capacity building team where we are looking at the individual starfish and how can we help them, but also taking a view from 60,000 feet and looking down on how can we help all the starfish as a collective whole at the same time. And Dr. Michelle and Dr. Mark are both incredible individuals who are looking at this problem of how can we be here to help the individuals, but also work so that this doesn't keep happening to individuals. How can global health and global surgery look to be preventative rather than always reactive?
For a long time in global health, there's been this dichotomy, this almost fight between relief and development. Should we treat the individual starfish, or should we figure out why all the starfish are on the beach and we can't throw them all back? And I think it's a false dichotomy. We should do both. And Mercy Ships' history has been very much in the relief side of things, and has done some really great work in that side, and has been probably over the last 5, 6, 7 years really moving into the other side as well, moving into the development side, moving into the fact that we can throw 2,000 starfishes a year back into the ocean, but there are billions and billions of people who don't have access to surgery, and we can also do something with that. We as a ship are in country, docked for 10 months, but previously in the country for a year before and sometime afterwards, and there's a lot of development that we can do in terms of training, in terms of advocacy, and in terms of research. And I feel like I'm hopeful. It seems like it's true that the ship is expanding beyond just delivery, which is super important. I don't want to say just delivery, but beyond delivery into those other 3 pillars, into training, into research, and into advocacy.
Yeah, so when I think of the medical capacity building program. One story really stands out to me, and I think it's important to say at the outset that we haven't got it all together. We're definitely learning how to do this, and sometimes it can be tempting to think, we've only had a surgeon or a nurse on the ship with us, working alongside us for 2 weeks. What could they possibly learn? And it seems like it's such a small drop in the ocean. But one story really stands out as in my mind as to how important just even a 2-week visit can be, and how that can change practice. So we had a surgeon who was an obstetric fistula surgeon, and he came to the ship with a couple of his nurses, and he was working in the operating room. The nurses were looking after the patients on the wards, and one of the things that they all noticed was that the patients with mercy ships were fed very quickly after the surgery, and they were got up out of bed and starting to mobilise and walk around the ward and things, and that was very different to what they did. And they noticed that our patients recovered quicker because of that. So they went back to their hospital, and they started doing the same thing just with that surgeon's patients, because they couldn't persuade the other surgeons to change their practice. And what they found was that it worked in their situation as well, and those patients left hospital a whole day quicker than what they were doing before. And leaving hospital a whole day quicker is good for lots of reasons. People in Africa have to pay for their surgery, so it cost the family less money, which is very important. It also freed up beds for other surgeries, and it meant that women could get back to their family and their responsibilities quicker. And what the surgeon and the nurses said to us was that it was so important that they were on the ship together. Together, they managed to implement actually what was quite a significant change. And then because the other surgeons and the nurses saw it, they were won over, and then they also changed their practice.